Hello friends, I am coming to you from Endo 2022, the annual meeting of the Endocrine Society here in Atlanta, and I've been learning a ton about thyroid issues because thyroid is in fact an endocrine gland. I talk a lot about hypothyroidism, underperforming thyroid. I want to talk today about hyper. That's when your thyroid is racing, it's overproducing hormones, and it can lead to all kinds of complications, some of them very, very serious. So doctors tend to kind of overreact, I think, sometimes, and want to get it under control very, very quickly, and I get that. There are three main treatments for hyperthyroidism, almost always caused by Graves' disease, which is an autoimmune condition that creates antibodies that kind of keep your thyroid in the on position. Think of it like jamming down on the gas pedal and your thyroid just races, puts out a whole bunch of hormone, your heart can race, you get anxiety and so on. It can lead to thyroid eye disease. There are three main treatments. One is surgically removing the thyroid. That doesn't get rid of the autoimmune condition, which may pop up somewhere else. Two is radioactive iodine, a radioactive treatment that destroys thyroid tissue. And three is long-term suppressive therapy. Methimazole is the primary drug that's used to suppress thyroid function. So we're talking about basically what the benefits are and the downsides of each of these treatments. First of all, long-term drug therapy is overwhelmingly the treatment of choice outside of North America. Whereas in North America, we tend to go for the more aggressive approach, remove the thyroid or do radiation treatment. What was interesting is that when they looked at studies comparing surgery, removing the thyroid, radiation treatment, and long-term drug treatment, the long-term drug treatment seemed to have the best outcomes. One, any kind of radiation can potentially cause cancer. So taking radioactive iodine can not only affect your thyroid, but affect other organs that concentrate iodine. So radioactive iodine has the threat of other cancers down the line. Two, if you remove the thyroid or due to radioactive iodine, there may be some tissue left and you may still have that long-term problem. But the third thing that was really interesting is that they found when people were on long-term drugs therapy to suppress the thyroid, again, methimazole, that after a number of years, a lot of those people went into remission. So they were able to actually stop the drugs. Now, that's not a guarantee, but some of them were able to stop the drugs after 4, 5, 6 years of being on the treatment. So the autoimmunity sort of spontaneously resolved itself over time. That doesn't happen. If you radioactively destroy parathyroid or remove it, you're always going to be hypo. Now you have to take hormone for the rest of your life, and there's a possibility the autoimmunity shows up somewhere else. So that was a really interesting study. And sort of an interesting review of those different therapies, and it seemed like the long-term drug therapy seemed to have the best promise. Now, also because it's an autoimmune condition, by changing your diet, getting rid of those things that trigger the immune system, like gluten and dairy, which is true for any autoimmune condition, you can also stop the Graves that way. It seems like with all these choices, changing your diet and using the long-term drug therapy seems to have the best promise and the best outcomes for patients.